Hello everyone. Today we are going to discuss the anatomy of nose. So in previous video we had completed regarding the ear. So try to revise it before starting the anatomy of nose and its pathological conditions. So first let us start with shape of nose. So here the shape is pyramidal in shape and it is divided into two parts by nasal septum. Okay. Then comes Haisner valve. What it is? So it is none other than a mucosal flap of nasolacrimal duct. Let me tell you. Here just imagine this as the eye and this is the inner canthi. So from here there is opening. You might have noticed in your eye. So this is connected to the nose. We can say this is the nose and it is connected to the nose and it is open and this nasolacrimal duct opens in the lateral wall of the nose. Here it gets open. Okay. So here in this opening we have this Haisner valve. Okay. So you might have noticed whenever we are crying we used to feel coryza within 5 minutes. So this is because of the presence of nasolacrimal duct. All the tears gets entered into the inner canthi of the eye and it gets received in the nose. Okay, so this is regarding the nasolacrimal duct and there exists the Haisner valve. And here I will give you a homework. What is Haisner's valve? So every time we used to confuse what is Haisner valve and Haisner valve, but I am not going to say what it is. So you people have to do this as a homework. Okay. Then comes osteomeatal complex area. With the name itself, we can find something related to bone, that is osteum and meatus. So here, this complex area is also called as Piccadilly circle. So here, the area of middle meatus where the sinus ostium gets open. So whenever there is any problem here for the opening of the sinus, that may lead to the pathogenesis called sinusitis. Okay. So here there are three things we discussed. One is shape of the nose. Then comes Haisner valve. Then comes Piccadilly circle. This is easy to remember. You people will remember. But Piccadilly circle is more important to remember. Okay. Next. Next comes concavulosa. So let's see what it is. So it is none other than pneumatization of middle turbinate. So you all know in the lateral wall of nose there are three different turbinates that we will read later. So concavulosa is none other than pneumatization of middle turbinate. Now comes the dangerous area of skull. So we all have this idea. So this dangerous area is below the nose and above the upper lip. So here it is mainly around the nose, vestibule and upper lip. So here why it is called as dangerous area of skull? Because here the veins are anterior facial vein and angular vein. What happens if there is any infection in this particular area, these veins drain directly into cavernous sinus and this leads to lot of danger. Okay, so this is all regarding the dangerous area of skull. Then comes lateral wall of nose. There exists lot of MCQ points for discussion. So first, in case of lateral wall of nose, we have three turbinates. Okay, three turbinates like this. We have three turbinates in the lateral wall of the nose. So here, that is superior turbinate, middle turbinate and inferior turbinate. The point to remember is inferior turbinate is a separate bone. Middle turbinate and superior turbinate are the part of ethmoid bone. This is more important, you should remember. Then comes the meatus. Okay, that's regarding opening. So in case of inferior meatus, we receive nasolacrimal duct. While reading regarding the Haisner valve, we read this. So in case of opening inferior meatus, here it is there, it receives the nasolacrimal duct, and then middle meatus receives, that is here, it receives the frontal sinus, anterior and middle ethmoidal sinus, and here there is a semilunar structure. Okay, that is called as hiatus semilunaris, which receives the maxillary sinus. Okay, then comes superior meatus, which receives posterior ethmoid sinus, and at last sphenoethmoidal recess receives sphenoid sinus. So these are all important MCQs related to the lateral wall of nose. So I am just repeating, there are three turbinates, and one among the turbinate, that is inferior turbinate, is a separate bone. Middle and superior turbinate belongs to a part of ethmoid bone, and then inferior meatus receives nasolacrimal duct, and the middle meatus receives frontal sinus, anterior and middle ethmoidal sinus, and then hiatus semilunaris receives maxillary sinus, and superior meatus receives posterior ethmoidal sinus, and sphenoethmoidal recess receives sphenoid sinus. So this is all regarding the lateral wall of nose. Now we are moving towards the paranasal sinuses. So first it is regarding the development of sinus. So you can use this mnemonic to remember it. My elite security force. So my M is indicating the maxillary sinus, which develops first, and then it is followed by elite, that is ethmoid, then it is followed by S, that is sphenoid, and then it is followed by F, that is frontal. Okay, so this is the order. So development of sinus, the order is myelite security force. Then comes maxillary sinus, which is called antrum of Highmore, and this you might have read in Materia Medica books. Antrum of Highmore, it is none other than maxillary sinus. So this is the largest paranasal sinus with an adult capacity of 15 cc. So you have to remember regarding this particular number. Okay. Then there are three different types of cells which you should know. First comes Agar-Massey cells, and these cells are none other than anterior ethmoidal cells. And then Haller cells, those are also anterior ethmoidal cells, which is seen in the roof of maxillary sinus or floor of the orbit. Okay. Then comes Onodi cells, which can be seen in the posterior ethmoidal area, mainly that is related to the optic nerve, and it is also called as posterior ethmoidal sinus. So this is all regarding the paranasal sinus. Important points are discussed here. So this is all regarding the anatomy of nose. So happy learning with us, and we will continue this in the next video. Thank you so much.